I'm Haley Welch. I'm going to be the student nurse today. Becca is going to be my evaluator, and Alexis is going to be my videographer. So, before anything, I'm going to check the provider's orders. So, for patient Jamie Wheeler, who was admitted from the skilled nursing facility yesterday with a medical history of mild dementia and rheumatoid arthritis, we're going to check the provider's orders for new medications to be given this morning. So Mr. Wheeler has, for 8 a.m. meds, he has erythromycin, 250 milligrams PO 4 times a day, varicella vaccine, 0.5 milliliters subcutaneous, times 1 now, dexamethasone, 4 milligrams intramuscularly, times 1 now, at 8 a.m. I'm also going to check that if he has any allergies, so he's allergic to codeine, and there's no other contraindications to giving his medicine. So I'm just going to now gather, so I'm going to get my MAR out, and then wash my hands. Then I'm going to get my medications ready. So he has, Mr. Wheeler has dexamethasone, 4 milligrams intramuscularly times 1, so 4 milligrams per 1 milliliter dexamethasone intramuscularly. So we're going to give that. We're going to give the erythromycin, 250 milligrams per 1 capsule by mouth, and he's going to get it 4 times a day, but for the 8 a.m. meds, he's just going to get 1 250 milligram capsule. The expiration date on this one is good, and the expiration date on this one is good as well. And then, lastly, he's going to be getting the varicella vaccine, 0.5 milliliters per 1 dose subcutaneously. And the expiration date is good on this one as well. All right, so before I go in, I'm just going to double check each of the meds. So we're going to do erythromycin, 250 milligrams by mouth, 1 capsule at 8 a.m. And then we're going to do the varicella vaccine, 0.5 milliliters per 1 dose subcutaneously times 1. And then the dexamethasone, 4 milligrams per 1 milliliter dose intramuscularly times 1 now. So have that ready. And then before I would administer the meds to the patient, I would just double check. I would do all my pre-assessments. So we would assess for erythromycin, we would assess for any infection before giving the medication. So we take vital signs, monitor appearance of the wound, sputum, urine, stool, white blood cell count. For varicella vaccine, we would assess for previous immunization history and history of hypersensitivity. And then for the dexamethasone, we would assess for, we would take his blood pressure, heart rate trends, fluid balance, presence of edema, lung sounds, serum levels, and daily weight. So if all of that's good, we're going to go in and administer the meds. All right. Okay, just get my MAR back out. Okay. So I'm going to go ahead and go in. Mr. Wheeler, I'm Haley. I'm going to be your student nurse today. I'm here to administer your medication. I'm just going to pull the curtain for privacy, and can you check, or can you verify your name and date of birth for me? Okay, great. And I see you're allergic to codeine. Is there anything else? No? Okay, good. Okay, so I'm also going to assess in the sites that I'm going to give. So skin integrity is good in the abdomen and the ventrogluteal site, and the patient is able to swallow. So I'm going to go ahead and sit him up. Bring the bed up to a working height. I'll just let you know what I'm giving you as we go. So, the first thing I'm going to give you is the erythromycin. So this erythromycin is it's an antibiotic for infection. So you should see resolutions of signs and symptoms of any infection. And if you feel any nausea or vomiting, let me know. Okay. I'm just going to prepare that. So I have my erythromycin, 250 milligrams PO, 4 times a day. We're going to give 1 capsule at 8 a.m. for Mr. Wheeler. Just going to put into the med cup. Okay. And give him some water, if I can find a cup. Well, we're gonna give him a full cup of water, bigger than this cup, but for this video, we're gonna show him with this. So here's your erythromycin, and here's your water. And I'm just gonna assess that the patient swallowed it. So he swallowed it, okay, no aspiration. Dispose of that. And then we are going to administer the varicella vaccine, 0.5 milliliters per 1 dose, subcutaneously, times 1 now at 8 a.m. So usually you give vaccines in the deltoid, but since this is subcutaneous med, we're going to give it in the abdomen for purposes of this video. So I'm just going to sit. I'm going to lay it down. All right, so I checked my varicella vaccine with the MAR, and we're going to, I'm gonna get out these, some gauze, and then we're going to use, so it's 0.5 milliliters, so we're gonna use a 1 milliliter syringe with blunt tip needle to draw it up, and then a 25 gauge and 25 gauge 0.5 millimeter needle. So we're gonna take off this cap, making sure not to touch it. Since it's already sterile, we don't need to clean it off. Okay. So we're going to drop 0.5 milliliters. So I'm going to pull 0.5 milliliters of air into the syringe. And then we're going to administer the air into the vial. And pull out 0.5 milliliters. And there's lots of air, so. Oops, scared me. All right, almost there. Okay, so 0.5 milliliters. We have no bubbles. I'm gonna take it out and place it back in here. And then okay, so now, since we're doing this in the abdomen, sorry, Mr. Wheeler. So you're gonna feel a little bit of a pinch, okay? But I'm just going to clean out, making sure to stay away from the umbilicus. Okay. So we're gonna do we're gonna pinch, and then we're going to inject this at a 45-degree angle. And then we're gonna hold for 10 seconds. And I'm gonna grab some gauze. Okay. All right. So, Mr. Wheeler, make sure to let me know if you feel any pain at the site, or any nausea, or if you get sore, we'll check and make sure so you don't get a fever. If you have any redness or a rash, let us know and we'll make sure to monitor that. Okay, throw away. Okay, and next we're gonna do the dexamethasone. So we have dexamethasone 4 milligrams per 1 milliliter intramuscularly times 1 now at 8 a.m. So we're gonna pull. So you're gonna be getting, just to go back a second, the varicella vaccination, you just got the varicella vaccination, and it was for, to prevent varicella. So, and the dexamethasone that I'm going to give you in intramuscularly in your ventrogluteal site is an anti-inflammatory, so to help with any inflammation. Some common side effects are depression, euphoria, hypertension, nausea. So we'll make sure to monitor you for all of those things, okay? All right. So we checked with the MAR again, and we're gonna use since it is 4 milligrams per 1 milliliter, we're gonna use the 3 milliliter syringe to draw up the 1 milliliter. And we're going to use a 23 gauge needle and some gauze. All right, so got that off, so that's clean. And then we're gonna draw up 1 milliliter of air. And then we're going to inject the air into a vial. And then we're going to pull out 1 milliliter. there's no bubbles. We have 1 milliliter of the dexamethasone. I'm gonna place it back in the needle to keep it sterile. And then we're going to replace it with the 23 gauge needle. Okay, so now we're going to find we're going to place it on your side so I can inject this intramuscularly into your ventral gluteal site. Sorry. All right, so to find this site, I'm going to place my right hand on your left, the greater trochanter of your left hip, and I'm going to place my pointer finger on your superior and your anterior superior iliac spine, and my index finger pointed towards your iliac crest, and then I'm just going to clean in between that spot, and that's where I will inject. And then I'll leave my gauze there, so I know where to go. And then you're gonna feel a little bit of a pinch with this one. And we're gonna go in at a 90-degree angle using the Z-Track method to pull your skin away. Okay. And inject that slowly. And then we're gonna hold this for 10 seconds. Put that away. Get rid of that. Okay. So let me put you back on your back. How do you feel? Good. Didn't even hurt at all. Great. Sorry, the bed's messed up. We'll make sure to fix that for you. Okay. So this goes to the sharps. All right. So with that one, I told you about the side effects there, so we'll make sure to monitor you for any nausea or anything like that. I'm gonna put your bed down now. Head up. Make sure the bed's at the low position, bed locked. Call light is within reach, bedside table within reach. And now I'm just going to take my gloves off, get rid of all this. I'm gonna wash my hands, leave the patient's room to document. So now I'm gonna document that Mr. Wheeler got erythromycin 250 milligrams at 8:15 a.m. PO and initial, and then the varicella vaccine 0.5 milliliters at 8:15 sub-Q in the left abdomen. So left abdomen is 2. Dexamethasone, he got 4 milligrams IM in the left ventrogluteal site at 8:15, and initial there, initial here, and initial. Okay, and then during my shift, I'm going to evaluate for the erythromycin, the resolution of signs and symptoms of infection. For the varicella vaccine, we're going to evaluate for prevention of diseases through active immunity. And for for the dexamethasone, we're going to evaluate the suppression of inflammatory and immune responses in autoimmune disorders, allergic reactions, and neoplasm. And we're going to continue to monitor for any adverse side effects. And that's all.